Have you heard of dimethyl sulfoxide? This amazing compound has been ignored for decades, but its potential benefits are too important to ignore. Discovered in the 1860s, dimethyl sulfoxide gained attention in the 1960s for its anti-inflammatory and analgesic properties. But why did it fall into disuse? Simply because there were concerns, often unfounded, about its safety, and the lack of comprehensive clinical trials led the allopathic medical community to reject it. But now researchers are revisiting its potential. Dimethyl sulfoxide offers numerous benefits, including pain relief, reduced inflammation, and improved drug delivery. It is also used in veterinary medicine to treat injuries in animals. Today, I'm going to highlight its analgesic effects in terms of conditions such as arthritis, muscular pain, particularly related to sport. Imagine a world in which dimethyl sulfoxide plays a key role in the treatment of chronic pain, arthritis, and recovery from musculoskeletal injuries. It would surely be a better world. Turns out that there is a wealth of evidence that demonstrates some compelling properties of dimethyl sulfoxide that help explain its action. It spreads rapidly throughout the body once it comes into contact with skin. It protects cells from a variety of otherwise lethal stressors such as burns, frostbite, loss of blood supply, radiation, and even sonic shock waves. It is a safe compound. The main side effects would be temporary concentration-dependent irritation when applied to the skin, and in some people, a garlic-like odor, but temporary. It significantly increases blood circulation throughout the body and, at the same time, removes edema and excess fluid from where it should not be. This is especially important for joints, as their structure predisposes them to have a limited blood supply, especially when they are damaged and need blood to heal. Dimethyl sulfoxide's ability to quickly heal injuries and eliminate pain may be due to its high anti-inflammatory power, restoring critical blood flow, being an effective muscle relaxant, protecting cells from dying, and blocking the conduction of complex pain signals. And this is already far better than those commonly prescribed alternatives such as opioids. But let's look at how dimethyl sulfoxide treats pain. This will allow you to determine for yourself why it may be a valid treatment for conditions such as arthritis, chronic pain, and muscle injuries. Dimethyl sulfoxide would selectively block pain conduction through tiny fibers in the nervous system known as C fibers, thus stopping pain characterized by tingling, pins, needles, and numbness without causing significant damage to the rest of the body or building up a tolerance to dimethyl sulfoxide. It has also been proven time and again that dimethyl sulfoxide increases the presynaptic release of acetylcholine, the main neurotransmitter of the parasympathetic branch responsible for rest and relaxation of the autonomic nervous system, while inhibiting acetylcholinesterase, the enzyme that degrades acetylcholine. Inflammation is associated with both pain and musculoskeletal injuries, but a large study has shown the protective effect of dimethyl sulfoxide on tissues by reducing inflammatory responses in injured muscles, reducing the production of inflammatory cytokines, neutralizing free radicals, which are both a cause and a result of chronic inflammation and a common cause of tissue injury, degenerative disease, and chronic pain. If you or someone you know suffers from the ailments I'm about to list, and you can add acute to all of them, you may be able to benefit from dimethyl sulfoxide. Acute inflammatory or traumatic situations, chronic conditions, bursitis, lumbar sprains, injuries such as strains, contusions, sports injuries, industrial injuries, and other traumatic situations. Also osteoarthritis, rheumatoid arthritis, neuralgia and pain syndromes, gout, arthritis of the foot and ankle, particularly the toes, heel spurs. It may help in the treatment of flat feet by eliminating inflammation and helping to heal damaged ligaments and muscles. The applications are many, and I myself am only just beginning to learn about and apply this compound. I invite you to join me in exploring the rediscovery of dimethyl sulfoxide. I'm very interested in your opinions and experiences with this extraordinary compound. If you like this topic, please like my video. Subscribe to my channel and turn on the little bell to receive notifications whenever there is new content here on this Holistic Health Hub. See you soon.